Hello, fellow classmates. Congratulations, we've almost made it. We just have a few more days left before we are officially graduates of the nursing program. Thank you for taking the time to look at this presentation and listen to us kind of explain our project or our topic and what it's about. We are covering healthcare, informatics, health information systems, social media, HIPAA violations, and continuity of care. Me, Xiomara, Monica, Janelle, and Kasey are the ones who have taken on this project, and we hope that you can get through this and know a little bit more just about the technological side and the aspects that it brings to nursing and healthcare in general, and really just how it can improve, but maybe not all the time be an improvement to what once was. All right, healthcare informatics. What this is, without simply reading verbatim what the slides say and putting everyone to sleep, healthcare informatics is the intersection of healthcare and technology. It can involve all different types of things, but the main goal is to make it easier on the patient and the providers. I feel like if things get to a point where it is making it harder on a provider or a patient, then we've really missed the point of what healthcare informatics was meant to be, which is to make things easier. Building off the previous slide, we now talk about the benefits of healthcare informatics. And the two that really stuck out to me were real-time, up-to-date information and better, safer care being provided. So the real-time, up-to-date information, what I really think about is when I was younger and I would go in and have my blood drawn for my yearly A1C for my diabetes, we'd do that, and then we'd go home, and 2 or 3 weeks later, they'd call us back and tell us what it is, or what it was, excuse me. And now, when I do that, as soon as those results are available, they're put in my patient portal, and no phone call is necessary, because as soon as they have the information, I have the information. And I think that is just one of the greatest things that's came out of this. There's no more you go in for a diagnostic study and they're like, all right, we'll see you in a month and let you know if anything's weird or not. Now, they'll usually give you a call and say, hey, this is what we found. Also, all of this information is available to you on your portal, which is, it's wild. I mean, just seeing how far healthcare has came, even in the last, 10, 15 years. But also, the better, safer care aspect is, especially with medication errors, they still happen, every day. That's something that is almost unavoidable when you look at the amount of meds given, even in Tennessee in a day. But really just the verification and some of the steps that it doesn't replace when you're giving meds, but it adds another safety measure in. The one that really kind of, not surprised me, but impressed me when I got into the nursing program and watching nurses give meds is the fact that when they go to the bedside and they scan this patient's armband with the MAR popped up, it's, I don't want to say hard to make a mistake, because it still is, it's easy to make a mistake, but a list of their meds will come up. And if you have a med that's not in there, when you scan it, the computer says, hey, you might need to double check this. In our system, we don't have this med for this particular patient. And obviously, it hasn't completely stopped medication errors from happening, but I feel like it has drastically reduced the amount of times and really given us another tool to help us protect ourselves as nurses. The last thing I want to touch on in regards to healthcare informatics is the trouble or the risk associated with all of that information being available online to the patient. I'm sure most of you have heard about the cyber attack at Children's, where thousands of patient records were essentially hijacked through the cyber attack. That is one of the things that people have argued about healthcare informatics and moving to a more technology-centered place to store records. If it's online, then it drastically increases the chance of something like this happening just by the fact of it being online. No matter the security systems put in place, nothing is 100% protected. And this is really something that has to be looked at when a new healthcare informatics, basically when a new program or procedure comes out that involves the use of technology in patient care. It's a risk that has to be looked at, and it's honestly risk reward of, is this significantly helping the patient, past the point that there's always still that risk that something like what happened at Children's Hospital could happen anywhere. Over the next couple of slides, my friend Xiomara is going to discuss healthcare information systems and all that entails.
Thank you, Jordan. In recent years, there has been increasing interest in the use of information systems in the healthcare sector. Hospital information systems, HIS, are one of the most widely used systems. They are software applications that have facilitated the way healthcare workers, such as doctors and nurses, share and record pertinent documentation about our patients. It has definitely changed and continues to change the way that we coordinate and share prompt and accurate records about our patients. There are different types of healthcare information systems used nowadays. We have the electronic health record, EHR, the practice management software, PMS, the electronic medical record, EMR, the clinical information system, CIS, and patient portals. The electronic health record, EHR, is used in private practices where information is stored at the clinic only, and if the patient needs a copy of the records, is printed in paper, and so the patient can take his information or her information to other healthcare professionals or hospitals. We also have softwares, healthcare information system softwares that are basically used to help nurses and doctors to help manage day-to-day operations in the office, administrative tasks, billing, online forms. We also have the electronic medical records. And this one is actually used at hospitals, but it can also be used in doctors' offices because this allows the sharing of records between doctors, specialists, hospitals, and other healthcare providers outside of the practice. We also have the clinical information system, and that one is typically used at hospitals. And this one as well transfers information such as prescription, patient health history, doctor's notes, dictation, patient results, and like I said, it's been used in the hospitals. We also have patient portals, and I think Jordan mentioned a little bit about how he used patient portals by getting test results. It also provides constant online communication between the patient and the physician, coding the need of a phone call, coding the need of waiting time for the patient. We live in a fast-paced environment. Therefore, it is important in our industry to have continuous on real-time information between healthcare professionals, and that's what the healthcare information systems do. Patients receive a more coordinated and connected experience as they move between healthcare providers. Overall, the benefits of healthcare information systems are very impactful. As we mentioned before, it enables communication between healthcare providers, hospitals, pharmacies in a very effective way, improve medication safety, improve clinical management of the patient, such as diagnosis and treatments, the patient portal that provides patients direct access to the medical information, appointments, reminders, improve efficiency and accuracy of coding and billing in the healthcare professional practice. I think another one that's very important is that allows data analysis. So it's able to help our doctors to make more informed decisions when we have the ability to analyze data. Healthcare records are shared more efficiently and cost effectively, and they can be shared privately. My peer and friend Monica is going to collaborate more in reference to the way the HIPAA have guidelines that we all have to abide as healthcare providers to make sure that our patient records are being managed in a private and safe way. Thank you.
As we learned, healthcare information systems has improved the way healthcare providers, medical facilities, and pharmacies share medical information to benefit the patient's continuity of care. How is patient personal information protected if it is accessible from several sources? What is HIPAA? The Health Information Portability and Accountability Act of 1996 is a federal law that requires the creation of national standards to protect sensitive patient health information from being disclosed without a patient's consent or knowledge. The Department of Health and Human Services issued the HIPAA privacy rule to implement the requirements of HIPAA. A major goal of the privacy rule is to ensure an individual's health information is protected while still allowing the flow of health information needed to provide quality health care. The privacy rule permits the use of health information and protects the patient's privacy. Covered entities are subject to the privacy rule. Covered entities include healthcare providers, health plans, healthcare clearinghouses. For example, a medical clearinghouse can process medical claims for the provider to the payer. Business associates, an organization or person using individually identifiable health information to perform a service or function, for example, utilization review or billing. HIPAA security rule and high tech. The security rule protects individually identifiable health information that a covered entity creates, receives, maintains, or transmits in electronic form. This is called Electronic Protected Health Information, or EPHI. The security rule does not apply to written or oral reporting of protected health information. The HITECH Act established levels of culpability for violations, corresponding tiers of penalty amounts that significantly increase the minimum penalty amount, and established a maximum penalty of $1.5 million for protected health information violations. HIPAA laws and medical students. Does the HIPAA privacy rule requirements prohibit medical students, nursing students, and other medical trainees from accessing patient records during their training? The answer is no. The healthcare operation definition of the privacy rule allows for training programs to practice and improve their skills as healthcare providers under supervision. Covered entities can create policies and procedures relating to the use of medical records for medical trainees. For example, a hospital's printed medical records for students' use excludes any patient identifiers such as the name, date of birth, medical record number of the patient in order to safeguard their privacy and work within the HIPAA guidelines. Additionally, students must participate in HIPAA training prior to studying or working in a healthcare setting. HIPAA privacy rule in consumer health informatics. Many consumers utilize the internet to connect smartphones, wearables such as smartwatches, and other devices to internet applications and medical portals in order to send and receive personal medical data. As methods of transferring and sharing private health information changes, the ability to enforce privacy rules is becoming more challenging. Which brings us to our next topic, where Janelle is going to talk about health information privacy and social media.
So how does social media and HIPAA correspond? HIPAA was created before social media was, so in its description, it doesn't have anything about social media. It's up to the hospitals to create their own policies regarding social media use by their healthcare workers to protect patient information. So what domain does social media have over healthcare information? So social media is a widespread and diverse platform that has been around for about 30-ish years. It has the ability to spread false information and correct information. As medical professionals, we need to use and engage in social media to reach our clients with accurate source of clinical information. So what are some cons of social media use in health information? One is that it is open for anybody to post anything they want about medical content, even if it's not verified. For example, the Washington Post uploaded an article regarding a woman who thought she found the cure for cancer by making this certain smoothie. So she made a video and she posted it to YouTube. About a year later, that woman's niece posted a description on the video saying that her cancer had actually returned and that this was not a cure because the patient had passed away from her cancer. Another issue is that social media gives the ability for misinformation to spread rapidly. So false information can be spread to thousands and millions of people with just one click of a button. This widespread and fast source provides convenience for the consumer. But in all honesty, if the information is not accurate, this is harmful for that patient. Another issue is that it could lead the consumer to have all the answer type of mindset. And what I mean by this is that people can look up anything they want on the internet. And so people may feel as though they don't need to visit their doctor because they have all the answers at their fingertips. This leads to the next point of potential patient harm. Whether the patient believes they have all the answers or they have this fast information at their fingertips, they may end up hurting themselves when they try these untested cures and remedies that are not verified. Lastly, healthcare professionals can post personal patient information. Whether on accident or intentionally, patient information could be posted from somebody working in the healthcare environment who knows their situation and background. And this breaks the whole concept of patient privacy. So what are some pros of social media and health information? One is that it's an efficient platform for medical professionals to upload information on certain disease processes. If a patient is unaware of a disease process or certain signs and symptoms, looking these up on a verified source written by doctors could be a great resource and benefit for that patient. Another pro is that social media can help break down the barrier between patient and doctor relationship. What I mean by this is that social media can make the patient feel more personal with doctors and health information. If you go on YouTube and watch videos created by doctors like Dr. Mike or Mama Dr. Jones, you feel as if you're sitting right there in their living room with them as they explain their topics. They also break things down to an easy understanding level, so patients don't feel like topics are way over their heads or something they could never understand. Also, accurate teaching is readily available, being provided by medical professionals. Teaching is so important in the healthcare environment, whether teaching about what comes next in the care process, when to visit the ER, or what to do when somebody is experiencing certain symptoms. Teaching from medical professionals is available to follow on certain verified websites. Lastly, social media can also be used to give warning to misinformation. Doctors have the opportunity to warn patients about false information that can spread on social media. Hearing this from a doctor makes the patient more aware of what websites they're getting their information from and what videos they're watching. It is our job to educate our patients on ways to use social media to their advantage regarding health information. We also need to keep in mind that every patient is different, so certain information on a disease may not fit them, and that they should talk to their doctor regarding personal health.
I chose 3 topics to really focus on for interventions. As future nurses, we can really make a difference if we work harder on providing resources for finding accurate medical information, continuity of care, and of course, always upholding the HIPAA laws. Inaccurate medical information is so easily obtainable these days. Social media sites such as Facebook, TikTok, Instagram has so-called healthcare providers giving information that may or may not be accurate for each individual person. Even if the person giving the information is a physician, they don't know everyone's unique medical history and should not be allowed to give blanket statements or generalized information about a certain topic. As nurses, it is always important to remind patients that if they have a question or a concern or have found some unique information on the internet, they should check with their doctor, because their doctor will be up to date with their medical history and will be able to give them more information about what would or would not work for them. As nurses, continuity of care is a really important part of our job. We can make such a huge difference in the patient's ability to succeed while in the hospital and even after. Making sure we contact who is needed and they have the ability to see our updated assessments about how each patient is doing will factor in how PT or OT comes. Or a great example of this is a pharmacist being able to look at a patient's going home medications and making sure the prescription's ready and accurate as to what the patient has been on in the hospital. Or a social worker will use our assessments and the doctor's recommendation on where a patient goes after the hospital, such as if the patient will go home or to a rehab facility, if the patient will need an in-home nurse, or if the family will be taking care of the patient. All of these are required to have a continuity of care for each patient. HIPAA is a federal law that requires the creation of national standards to protect sensitive patient health information from being disclosed. Since HIPAA is a federal law, anyone who violates it can be held accountable by the court with legal fees, fines, and even jail time. HIPAA is a huge part of our job as nurses. No one wants their information to be spread around throughout the community or talked about on social media because you thought they were an interesting case or anything like that. An important part of HIPAA is making sure that you hold yourself accountable and as well as your coworkers. So if you see something or hear someone saying something, you need to report that to your HIPAA compliance officer immediately. You always want to make sure that when you walk away from your computer or your desk, that you close and lock any information, whether that's your computer or a chart. You never want to give anyone else any access to log into these things under your name, as you are also going to be in trouble. Also, it's important to not access any information that is not pertinent to your current patient load. Don't go into everyone else's charts because they have an interesting case. Thank you for taking the time to listen to our project. I hope you learned something and I hope you really enjoyed it. Thank you.